Good afternoon and welcome to the weekly update here at St. Clair County EMA. Sam Bierman has the day off, very much needed rest for her, and she'll be joining us in the very, very, very near future. But I'm here with Chairman Mark Kern today, and Chairman, a lot of developments over the last 24 hours, so we've got a lot to talk about today.
We do, and I'll try to fill in for Sam on the numbers. Sam's got this thing down, so I'll just try to be as close to what Sam does as possible. Today's numbers, we've tested in total 25,309. Of those, we have 2,803 positives. Now, 71 of those are new, and those are males and females under 10 into the age of in the 90s. And so from last week, since we do this once a week now, we may start doing it on a daily basis again, given the increases that we've seen. Since last week, we did 3,863 new tests. We've done 3,863 new tests. 391 of them were positives. So those were new positives that came into this. That's about a 10.1% positivity rate, which is pretty high. And so that's part of the reason why we think maybe it's time to get back and do this every day, to make the point that we've got to do a little better job out there wearing masks and washing our hands. The negatives in total now are 22,300. We have 206 pending cases. And the good news, we have no new deaths today. Our deaths stand at 147 in St. Clair County, which is way too high a number. And those that have completed the IDPH required 14-day quarantine period, 2,020 people. The state totals for today, the state's tested 2,122,607 people. The positives are 157,950. That's an increase of 1,257 positives. And deaths increased, unfortunately, and our condolences go out to those families, increased by 25 to 7,251 people. And those are the state numbers. Hospitalization numbers, COVID-19 related patients in St. Clair County hospitals today stands at 24. That's an increase of 1 over last week, so that number remains pretty consistent. And the good news is none of those patients are on ventilators. Our congregate living facilities in outbreak status, now these are cumulative numbers that started from the beginning of when we started doing this back in March. And these are staff and residents with 2 or more COVID positives, or 2 or more people that have COVID-like illness symptoms. So in these facilities, Adaptive Illinois has 2 cases with 0 deaths. Atrium of Belleville, 2 cases and 0 deaths. Autumn Meadows in Cahokia, 6 cases and 0 deaths. Brea of Belleville, 57 cases and 7 deaths. Brea of Cahokia, 29 cases and 3 deaths. Bradford Place in Swansea, 4 cases and 0 deaths. Caritas Family Solutions in Belleville, 12 cases and 0 deaths. Caseyville Nursing and Rehab, 6 cases and 0 deaths. Cedarhurst of Shiloh has 13 cases and 0 deaths. Cedar Ridge of Lebanon has 73 cases and 10 deaths. Cedars of Lebanon, 2 cases and 0 deaths. Colonnade, 5 cases and 0 deaths. Don Bosco Home in Belleville, and I believe this is a new one, 2 cases and 0 deaths. Esquiline Damert Center at the Shrine has 2 cases and 0 deaths. Four Fountains, 104 cases and 27 deaths. Help at Home Belleville, 2 cases and 0 deaths. Help at Home O'Fallon, 5 cases and 0 deaths. Integrity Healthcare Belleville, 6 cases and 0 deaths. Knollwood Retirement Center, Caseyville, 8 cases and 1 death. Lebanon Care Center, 56 cases and 11 deaths. Memorial Care Center, 49 cases and 5 deaths. Mercy Rehab and Care Center, Swansea, 5 cases and 0 deaths. New Athens Home for the Aged, 57 cases and 7 deaths. St. Paul's Home, 54 cases and 15 deaths. Swansea Rehab and Care Center, 41 cases and 8 deaths. And TDL Incorporated Belleville, 4 cases and 0 deaths. And remember, those are all cumulative numbers, numbers that have accumulated since we started keeping track in March. So at this time, we'll move into the zip code report. And I think the way we're going to do this, we're just going to talk about increases from 1 week ago to show you the impact that testing 3,863 new people has made. In 62059, the number stands at 9. That's an increase of 2 over last week. 62201, the number is 145. That's an increase of 9 over last week. 62203, the number stands at 92, and that's an increase of 15 over last week. 62204, the number is up 11, and it now stands at 86. 62205, we're now up to 100. That's an increase of 9. 62206 is at 258 now. That's an increase of 45 people over the last week. 62207 increased by 27 to 146. 62208 went up by 25 to 145. 62220 went up by 21 to 241. And 62221 went up by 40 to 238. 62223 went up by 26 to 106. And a new zip code since we met last time is 62225, and they register 10 COVID positive diagnosed people in that zip code. 62226 increases by 37 this week to 62226, or 62226 increases by 37 to 279. 62232 went up by 10 to 60. 62239 went up by 2 to 24. 62240 stayed the same at 6. 62243 went up by 1 to 12. 62254 went up by 1 to 103. 62255 went up by 1 to 8. 62257 went up by 1 to 14. 62258 went up by 7 to 32. 62260 went up by 10 to 26. 62264 went up by 1 to 60. 62269 went up by 29 to 156. And 62285 went up by 21 to the number of 24. So we've seen significant increases this week and a 10.1% positivity level, Herb. That's not acceptable. The state really has set an 8% level as where they think you have alarm bells going off.
Well, that's what I want to talk about now. I think it's important, not that all of this isn't important, but as you know, we've reviewed the new from IDPH that came out yesterday, the metrics, and you've touched on that briefly here. The 10% is not acceptable, and you know, we want to make sure that everybody is aware of that. Our page blew up yesterday when that notice came out. We've had time to look at that now, and that's one of the driving forces about going back to doing a daily briefing, which we'll start that on Monday. We've already I've got the CEO of Memorial Hospital is going to be here because based on the metrics yesterday, the hospitals could possibly be affected. And so we'll hear from the President, Mike McManus will join us on Monday. I felt another thing that we should talk about, the paper that we sent out to all the mayors and chiefs today from the Liquor Commissioner, from IDPH, and the Liquor Commissioner kind of spelling that out.
So according to the guidelines, they're saying that if we are forced to make changes because of the positivity rate and the high positivity rate that we have in our region. In our region now is St. Clair, Madison, a few other counties, Washington, Bond, Monroe, and Randolph.
Yes, Clinton.
And Clinton.
Yeah.
Those are the counties now that we're being paired with, so that is a change. But if we're higher than 8% for 3 days in a row in that area, they're going to ask for changes. And part of that is that they think bars and restaurants need to then limit access. And so we sent out this letter today just so that the owners of liquor establishments understand that it's very important that they're following all the rules that have been set out by IDPH, the wearing of the masks, the cleanliness, all of those things that they encourage. We can stay right where we are today, but we just have to meet the goals of how many people are getting sick. We need to keep it under a certain level so that we don't have problems in the future, and certainly that we don't have problems with the hospital surging.
Well, and that's what I answered a lot of the questions on the page yesterday, and we are watching the numbers. We saw something similar to this back over the Memorial Day holiday, and now we've had the 4th of July. We're seeing this spike, so we're hoping by Sunday or Monday of this week that we see those numbers start to go down. I mean, we had 71 new cases a day. Of course, we're doing more testing, and so that's expected that way. But
the positivity rate doesn't have anything to do with
test.
how many you test.
Exactly.
I mean, if we tested 3,863 people from last week, 391 of them were
Tested.
positive. That's a 10%
10%.
level. It would have. It just is that's a big number.
And we are going to be doing, we've got the mobile testing sites that's been out there. They were in O'Fallon this week. They've been throughout the whole county, basically. Next week they're in the Dupo area. They're coming to Fairview Heights. So, we're encouraging everybody to get tested because, as you can see from your zip code reports and those who are following us, it's everywhere. It's in every zip code that we have in the county. One of the new statistics they put out there is the age. Nationwide, that age limit now that they're seeing a lot of people affected is at 20 to 29 years of age. We're seeing that right here in the county.
So as we're tracking and tracing, that entails a phone call that's made to the individual that is COVID positive, and the questions are being asked. How did you know how you contracted this? And they're probably the most common answer is we had a gathering with friends. Large gathering, people weren't wearing masks. That's how we contracted it. We had a number of people say we were on vacation, and people tend to let their guard down. They want to have fun. They're on vacation, and so wearing a mask isn't always the first thing in your mind. But unfortunately, until we get this vaccine and until it starts to work and we get those levels low, a mask is in our future,
Exactly.
and there's no doubt it's a pain in the neck to put on and to wear, but it's worth it to try to keep this spread low so we can continue to keep our stores open, continue to do the things that we're doing right now, and keep our economy flowing. Wearing that mask is a sacrifice, but it's something you're making for the common good.
Well, and Team St. Clair has worked so hard to get us into Phase 4. I mean, with all of our followers that's been doing it, and you spreading the word to your friends and neighbors has helped drastically. I found it interesting. This week we had our conference call with the mayors for the first time in a couple weeks and brought them up to speed because we'd been tracking this. As we tell everybody, we watch these numbers every day. So we had that meeting on Tuesday, and the mayors have all been on board, as you well know. The police chiefs, the fire chiefs, they all understand. We've all worked hard to get into Phase 4. The last thing we want to do is to go backwards. And we're not sitting here saying that it's going to happen tomorrow, but if we aren't careful, we heard yesterday from the IDPH, they came up with the 3 W's, wear a mask, wash those hands, and watch the social distancing. And that's what we've been preaching since March, and that's what we need to continue to do. I've seen now where Walmart and Target are going to require, if you come in the store there, you got to have a mask on. So I think that's being responsible on those corporate businesses. I think they're realizing that we don't want to go backwards.
And many of the smaller businesses have already been doing that all along. And just so we have a benchmark to think about, in our region, today we were 7.2%, and 8% over a 3-day period is when you have problems. So we're not that far away. 7.2 and 8% are not that far away from each other.
Not that far.
Hopefully, as Herb has said, Some of this may have been July 4th, and we may be seeing a spike because of that particular holiday. Let's not emulate that holiday. Let's from now on, let's just realize we gotta be more careful, and we gotta wear masks, and we gotta get out there and get a hold of this thing.
Well, one of the mayors that I talked to yesterday, I found it interesting, had actually, through the tracing, had been able to determine from people that were being asked some questions, like you said, oh, we had some friends over in the backyard, and that's where things happened. One of the other places were at the barber shops and the beauty shops. People went in and people didn't have masks and that on. So those are the things we want to continue to remind those business owners. Enforce those policies. It's only helping all of us. And if you stop and think at the amount of time that you have to wear that mask, other than if you have a job, an essential job that requires you to have it on all the time, you don't have to have it on in the car. If you're at home, you don't have to have it on. So if you run to the store, you get to the store, you put it on. When you come back out, you take it off. So if you would just stop and think, there's not a lot of hours in the days that you're wearing that mask. As you said, it's a pain. But the benefits of it, doing a gentleman posted on the other day, he wears a mask because you don't want to feel out what it's like to have to be on a ventilator.
And if you want to know how effective it is, try to blow out a candle with a mask on, and you'll find that it greatly restricts the airflow. So then that means if somebody's around you and they're coughing or they're sneezing, it just doesn't make it through that mask. So not only are they protecting you, but you're protecting them, just in case you might be asymptomatic and not know that you have it, or you might have an errant sneeze that comes up for whatever reason. That mask is going to protect you, and it's going to protect the people around you.
And I want to give a shout out to all the local mayors from the conference call. We asked them to put out some social media posts and some PSAs, just reminding their constituents to wear the mask, practice the social distancing, and some of them already did that. The mayor of Fairview Heights, Shiloh O'Fallon, put out a release, and several other ones have called and said they're doing that. I think we just have to keep that out there in front of them. The police chiefs, like I said, and the fire chiefs, everybody understands that we're all in this together. Team St. Clair, we want to keep that rate down. We want to stay in phase 4, and we want to keep our businesses open and try to get back to this best sense of normal that we're going to know moving forward. And we can do that. You said that from day one. We're going to follow the science, and we're going to let that dictate to us, and we haven't strayed from that. We hear people, and I tell them all the time, yeah, you can voice your opinion. You have the right to do that. But I have a right to be safe, and so does everybody else. So I want you to wear your mask, and we'll all get through this. And so we're going to be back here, like I said, starting Monday, every day at 3:30. Hopefully, come Monday, we'll have news that I was following these numbers from the 4th of July, and we will see them start to go down. But if not, we'll continue to stay focused and move on. We'll be
And
back.
at least Sam will be back with us.
Sam will be back, and she can keep us in track. But what a job she does in the health department, and their work is mounting every day with the tracing going on. And I can't say enough for the health department with what they're doing, plus all the other duties that they have to continue doing throughout the county.
We're on the phone every day with Barb Holt, and
Oh.
she's working on these testing sites. And
Yes, it's great, and our friends down at the Eastside Health District, Liz and them, they're out doing their job and getting those numbers into us every day on time. It really makes it easy for us to bring that information to each of our followers, and we want to thank each of you that take time to follow these briefings and share it. That's a way to get it out to your friends and neighbors, and I follow it. My staff does too, and we see some of the discussions that go back and forth. Some people are just dead set against, they don't want to wear a mask, but we've actually seen some that says, wait a minute, because here we're seeing there was a governor of Oklahoma or somebody just got affected with it. So back and forth, when you just remember that. I want somebody to tell me how this virus knows your religion or your political agenda. It doesn't. it's not just affecting one group of individuals, it's everywhere. It's your household. How does it know to get to all these zip codes? It's everywhere. It's here in St. Clair County. We're going to fight this invisible enemy like we've been doing with the help of Team St. Clair. So we'll be back in just a few minutes with our lovely ladies, Cindy and Daisy, who I broke the news to that starting Monday we'll be back daily. And they'll translate this into the Spanish community. So everybody have a good rest of the evening, and we'll see you back here on Monday afternoon. Thank you.